some of the foundations came from this perspective of, let's make sure it's a person from Compton sort of running the Compton store. And let's keep all these social equity franchise stores in the neighborhoods where they're really needed. And we said, no, these stores are needed everywhere. And we want the Compton, entrepreneur to run the Compton store, but then also to run the store in Silver Lake, you know what I mean? And Studio City and et cetera. Because it's not just about access to healthy food, it's about economic empowerment.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today. This episode is adapted from a recent webinar. Enjoy.
Sam Polk is the founder and CEO of Everytable, a social enterprise on a mission to transform the food system to make delicious and healthy food affordable and accessible to everyone, everywhere. A former hedge fund trader, Sam left a successful career on Wall Street to follow his heart, to fight food injustice and inequality in America. In 2013, he founded a nonprofit called Feast, originally called Grocery Ships, to address food-related health problems in South Los Angeles by helping family food providers make healthy choices through nutrition education, cooking classes, free produce, and support groups. In 2015, Sam created Everytable, which offers made-from-scratch meals priced according to what is affordable in a specific neighborhood. To date, Everytable has sold more than 3 million fresh prepared meals throughout communities and on college campuses across greater Los Angeles through a combination of grab-and-go markets, a home delivery service, and smart fridge vending machines. With the backing of food-forward investors like Kimball Musk, Maria Shriver, Gwyneth Paltrow, Tom's Social Enterprise Fund, Acumen, the W.K. Kellogg Foundation, Annenberg Foundation, and the California Wellness Foundation, Everytable has the potential to work in every major metropolitan area across the country. And we are excited to welcome him to our meeting today.
Well, first of all, thanks a lot for having us. We really appreciate it. And, I think the thing, there's a couple of things to talk about maybe that weren't mentioned. But so, as it talked about, my history is, Wall Street and then starting a nonprofit. And so I was working in South LA with all of these moms on a daily basis and basically came to understand that there was very real demand for fresh food. And so that's when it sort of, it was almost like my sort of nonprofit background and my Wall Street background started to intersect. And I started to, wonder, why, if there's so much demand for healthy food, is there no supply in underserved neighborhoods? And there's actually there's a million reasons: structural racism, poverty, so many. But as far as the business models of food businesses go, there's actually sort of pretty clear reasons. And they all have to do basically with underlying business models and perishability. And so what I mean is, the largest food companies in the country are fast food companies and CPG companies, like your makers of, cereal and soda and chips. And the reason those companies are so big is because they've figured out how to sell food so cheaply. And the way they sell food cheaply is actually remarkably the same, which is that they basically use this structure of centralized production and national distribution. So, one way to think about it is like the maker of Corn Pops cereal will have a single factory where they're making all the boxes of Corn Pops in the world, huge economies of scale, huge efficiencies, automated robots doing a lot of the work, dramatically lowers the production cost of that box of Corn Pops. And then once the box is done and comes out of the factory, they put it on trucks and send it all over the country, where it sits on retailers' shelves, shelf stable until somebody buys it. And, it's great for the business who's making it because they can do these huge runs from that central kitchen to keep costs low. And it's great for the retailers who are selling it because they've got no waste risk with their box of cereal because it's not going to go bad for 6 or 9 months. And so it's because of that sort of efficient system that they're able to keep prices so low. And the key behind that is that it's all about non-perishable goods. And the same thing is actually true for fast food, where, you think about fast food as a restaurant, but a fast food restaurant is the end of a national supply chain that is basically just exactly the same thing, a supply chain that's based on, shelf-stable products made in a huge factory and then sent all over the country. So think about, McDonald's, your bun is made one or two factories, frozen beef patties, cheese, pickles, frozen fries, just, mass produced and then distributed. But of course, the reason that works is because there's no perishability. And this is basically like a long answer to the question of like, why does a salad cost $15 and a burger and fries cost $6? And this is really the answer, because if you think about, for example, how a sweet green works, is ingredients, the fresh produce and the meat will come into a city and then gets distributed to the restaurant level. And at the restaurant level is where they cook and process it and turn it into a salad. And if you start thinking about, a sweet green or really any fresh food restaurant as a food production facility, it's completely inefficient in terms of, if Sweet Green's going to have 20 restaurants around the city, they're going to have 20 kitchens, 20 teams of people, 20 sets of equipment. Their rent is going to be in the most high rent area. And all those reasons are why the cost creeps up and up and up. And so what Everytable did is we basically said, look, we know that we need to hit this $6 price point in Compton for us to be competitive. And, we are basically busting this myth that there's no demand for healthy food in Compton. But what there is demand for $6 meals, basically. And so the way we do that is we have this central kitchen where we're making everything from scratch and then packaging it in grab-and-go containers, so that when we open a store in Compton, instead of it costing like $1.5 million like a standard restaurant, or requiring 10 people to run, or requiring 2,500 square feet of space, our restaurants cost $200,000 to build, and 700 square feet of space, and be run with one or two people. And so that's how we make healthy food more affordable for everybody. But we also believe, as you know, that affordability means different things in different neighborhoods. So, when we open a store in Brentwood, it'll be $7 to $8. Great price, huge value to the folks in Brentwood. But when we open a store in South LA, it'll be $5 or $6, even better value. And it's really about sort of like, equality through equity, where it's like, it's not the same price for everybody. It's actually offsetting the structural imbalances that, many folks in these neighborhoods have started off facing. And I think that's the last thing sort of I'll mention sort of in this group, where there's two things that sort of weren't mentioned that may be relevant here. One is that, we raised money from Kellogg and Annenberg. We actually just found out we just got a $1 million grant from the Kroger Foundation. And all of that is going towards what we call our social equity franchise program. And so, if you think about franchising is a great way for businesses to grow. Domino's is all franchise, McDonald's is all franchise. But the problem with franchising is, like so many, industries that perpetuate privilege, you've got to have money, you got to have capital basically to get into it. And so, opportunity is not evenly distributed, but talent is. And so we find, really incredible entrepreneurs from historically marginalized backgrounds. And when we find them and they want to start their own Everytable restaurant, we then have gone to these large foundations so that after we train these folks and they go through what we call Everytable University, then we can lend them the money to build their own franchise. So over the long run, we think we're pushing against structural inequality, both through the pricing and locations of our restaurants, but also through economic ownership. So, at the end of the day, if we do, succeed in our very ambitious vision of really becoming the largest fast food company in the country, it will be, in partnership with tens of thousands of social equity entrepreneurs that own their own Everytable businesses. And then the last thing to mention is that, we just closed this $16 million round of funding, Series B funding, that was led by Kaiser Permanente Ventures. And it was Kaiser's first real investment into fresh food. And so we're really excited about that and sort of the healthcare world addressing social determinants of health. And then we're also going into this medically tailored meals business where we can leverage our operational and logistical capacities to also meet the needs of patients who are suffering from, a specific, set of, diagnoses. And so that's sort of just beginning for us, but, we're really excited about that. So I'm going to pause there and see if there's any questions.
Hey, Sam, this is Charles. Great work. I really applaud what you're trying to do. A couple of questions. One is in your kitchens, with COVID and everything, are you having difficulty going after PPE and protective gear for your employees and things like that? And then the second question from a healthcare perspective is, did you hire dietitians and whatnot to make sure that the stuff you're delivering is, it's fresh, so obviously it's better than fast food, but can you talk about that process a little bit?
Yeah. So great questions. So the PPE, we've been successful getting it, but it's expensive. So that's been a big problem. But we've had to figure out how to sort of restructure our kitchen to keep social distancing, et cetera. And we've been successful at that. And then as far as the dietitians go, yes, although, I'll tell you a little bit about our strategy. So yeah, we do have, dietitians, especially working with us on the medically tailored meals, menu, but also have consulted in general. But there's sort of two beliefs that we have. One is exactly what you said, which is like, for us, it's not about a certain sort of calorie range as much it is about being fresh and using whole food ingredients, et cetera. But then we do also have these, calorie and saturated fat and sodium guidelines that we follow. But one of the things that we've sort of been very focused on is actually not leading with that to the customers, because we wanted to make, delicious, amazing food that anybody could eat that is not just for people on a diet, basically. And I think we've done a good job of sort of like, hewing and accomplishing both of those targets.
Debbie Rosen from Northeast Valley Health Corporation. So this is amazing, amazing work. I'm wondering, have you thought, or maybe that's what we're going to talk about today, what can be the relationship between our organization, safety net providers who are in the communities, the low-income communities, and are really striving to have some of this fresh food at a good price. We are currently doing food distribution. We work with Food Forward and other organizations, and we have a CalFresh grant, but this is taking it to a higher level. So I'd love to hear ideas about partnering.
Yeah, well, great. Thank you for asking. And I think, there's a few things that come to mind initially. One, if there's a physical location that you have, a hospital or a clinic, sort of with a certain amount of people, we can build an Everytable store or location in that sort of facility. So we're doing that a lot with Kaiser these days. So that's one thing. We also have this network of smart fridges, which is basically like healthy vending machines. So we can put smart fridges throughout those same facilities so that not only your patients, but also your providers and staff can have access to fresh, healthy food at all times, literally where they're working. We also have, and it sort of showed in this video, this subscription delivery business where, we will drop a box of these fresh meals on your doorstep. And the way the pricing works for that is the same as the stores. So if you happen to be in a zip code of a neighborhood that's, below the, average household income in the city, you'll get a $5 price point. And if you're in a more affluent zip code, you'll get a $7 or $8 price point. And so, one would be sort of like marketing this to your potential patients, and we could find some, relationship where we give a discount to those patients or something like that. And then the last thing that's interesting is the CalFresh thing, where we're sort of working on that pretty hard to make sure that, like right now, our restaurants can take the EBT cards for the restaurant meals program, but they can't accept full SNAP. But we're working to make that happen because, the funny thing is, like, I think our business model in some way sort of like shows something that's wrong with the system where, you can't really get a salad made by us on SNAP, and our stores can't qualify yet as SNAP because they look too much like a restaurant. But all the center of a grocery store is prepared food. It's like, Corn Pops didn't come out of the ground like Corn Pops. They were made somewhere into a thing. Same with Pop-Tarts, same with Hot Pockets, it's just that they're shelf stable. And we've got all this federal regulation supporting processed and sort of unhealthy food, basically.
Sam, this is Elkin Salinas. I work here in Los Angeles, and actually I've been to one of your stores here in downtown LA. I live about 2 blocks away, and I've never actually known the story behind Everytable. So I'm really appreciative, obviously, of the work that you do and, the mission. I guess my question is, I have visited an Everytable, and I wanted to ask about, especially here in LA, it is a predominantly Hispanic county. So I wanted to ask about like variety, because I know that, again, it's been a while since I've been to one of the stores, but I wanted to ask about, how do you put it, the differences in terms of like food variety, especially for, different communities. I know South LA is predominantly Latino kind of community. So I wanted to ask about just, how do you appeal to, the people who understand McDonald's, right? You know what you're going to get, but I'm curious about, different varieties of meals, making it maybe culturally appealing. So I wanted to ask what your thoughts are about that.
Yeah, this is a great question. So we, I would say a starting point for us was that we knew that we couldn't come into South LA sort of carrying sort of wheatgrass salads with lemon vinaigrette, basically. And so we've basically, designed a menu, and literally the theme of our menu is celebrating the cultures and cuisines of Los Angeles. And it's sort of premised on this idea that, in Brentwood, they have a certain idea of what healthy food looks like, right? But the truth is that all cultures basically had cuisines that were basically healthy and basically delicious. And that's sort of how humans have evolved. It's only in the last 50 years that we've gone to this sort of like crazy madness of prepared or processed and junk food. And so, for example, some of our, best sellers of all time have been the Puebla chicken tinga, which has been on our menu since the very beginning. We launched with pozole, which has done really well. We've got our best-selling dish of all time is actually something called Trap Kitchen chicken curry. And Trap Kitchen are these two Compton chefs who started this, soul food delivery business out of their grandmother's kitchen, and it got so popular that they both got 300,000 Instagram followers and then got shut down by the county of Los Angeles because it turns out you're not allowed to do that. But we partnered with them to make basically this like chicken curry dish that is out of this world, super healthy, super delicious, super filling, and it's sort of beloved. And we sort of like, if you think about our challenge, it really is, can we make food that works well in Brentwood and Inglewood? And the answer that we've come to is like, it's almost like the Inglewood customer is the more sort of discerning customer that we really have to please. And we trust that if we can make food that folks in Inglewood will like, that is super healthy, Brentwood folks will like that as well.
I do want to circle back to, this partnership, especially, this is a room full of safety net providers, California-wide and also Colorado-wide. Do you have any ideas for how you're looking to expand or ways that we can partner, outside of Los Angeles, like any insights onto, how we can start to maybe think about partnering? Many of these same issues are, in every community. And I think, I think folks would like to hear that.
Yeah, so we're expanding in Southern California, all over Southern California right now. So including Orange County, Riverside, Santa Barbara, San Diego, et cetera. So that's all partnerships on the table there. And then we're also expanding in New York City, starting in Q2, Q3 of next year. We're unfortunately not in sort of Colorado yet, although it's on the agenda. And then partnerships, it's really like, from medically tailored meals to just this idea of food as medicine. Like, I do think that we're the only company out there right now making like truly delicious, healthy, fresh food that, when we sort of, between us, when we first contracted with the government in the midst of the coronavirus pandemic, we were selling them meals at $4.50. And, we weren't making a lot of margin, as you might guess, on that, but we made it work. And so, our whole system is built around, efficiency and, really fresh food at really low prices. So I do think it has massive, massive health impacts on folks, and that partnerships, we are open for business for partnerships if anybody wants to talk to us.
Kind of on a similar note, so my name's Amelia. I am with Jefferson Center for Mental Health in Colorado. And you obviously right now are operating mostly in like metro areas, cities, high populations. Have you thought at all about when you kind of like take over and change the world and become the McDonald's of, healthy food, make that the thing, how this will look in rural places? And when I think about your distribution and how quick it needs to go, even I'm sure, as you can imagine, when it comes to healthcare and rural locations, there's trouble reaching people, getting to them, even for delivery. And just curious, as you've thought about the future and kind of reaching people that are harder to reach, what have you thought about?
Yeah, I think there's sort of like good news and bad news. Like the bad news is, as you sort of intuited, it's like our model sings the more dense an area is. The good news is that it's not sort of a one size fits all model. So for example, when we started, our, central kitchen was 250 square feet somewhere. And so with a model like that, like you can make it work with, 3 or 4 or 5 stores. So I do think that we will be everywhere, maybe not, the most rural areas where that's just not going to work, but in increasingly rural areas, it's just going to take us longer to get there because we'll start with the most dense areas first.
Well, if you want to partner when you think about the rural areas, remember my name.
I will.
There's a question in the chat about collaborations with schools. And I also want to add on a question around, so you've spoken about food as medicine, which I'm a strong believer in. But food is also a place where people come together and feel comfort. And it's also one of the first things a person would step out of the house for their children when they are in need. So behavioral health now being a huge issue in this country, and no way that the resources that the healthcare centers will be enough, and also takes a lot for a person to go to a healthcare center to seek those services. Any thoughts around your role around helping people getting access to services when they may not be coming to clinics?
Yeah, I mean, the only, we've thought about that a lot as far as sort of food being a place of gathering. And so how we sort of started was these individual meals, which actually wasn't sort of particularly predisposed to that. You'll see us this year start launching what we call sort of components, which is basically almost like family style meals. Like you can get, 4 to 6 pieces of salmon or, roast chicken, and then sides of, sweet potato mash and green beans and whatever, so that you can actually basically create a family meal using that totally fresh with very limited cooking. So I think that's one thing. And then the second thing is our delivery model is really about sort of getting, that is, candidly why we sort of were such a good solution for the city of Los Angeles, because during coronavirus, all the food relief infrastructure has been about how to get people to the food, whether it's the food bank or soup kitchens, et cetera. And all of a sudden you had vulnerable populations, whether elderly or whatever, who didn't want to leave their homes. And so it became, okay, now how can you get the food to the people? And that's why Everytable, because we've structured it like this, where we control the production of food, the kitchen, and then also the refrigerated delivery vehicles, we can go anywhere, people need us. And it's also, we did a partnership with, I think, like Open Society around the election, where we put information on voting and voting rights into the boxes as we were distributing them. So it's a good sort of conduit for marketing in some ways.
Can you also talk about your social equity franchise program? It's fascinating to think about how you use this to actually build up the skills in a community and provide those sort of opportunities to run a business. Are you just really early in, or have you learned anything that you could share?
Well, we're early in, only that we got all these program-related investments from the foundations, and we're rapidly building it out, and then coronavirus hit. But now we're launching our first one in Hollywood actually this month, basically. So, and then we've got, plans and funding, it looks like, to build 30 next year and then another 30 the following year all around Southern California. And we'll start doing the same thing in New York City as well. And it really is for us about, really about ownership. Like, we are big fans of sort of a push to raise the minimum wage to $15. And at the same time, it doesn't really change the racial wealth gap. But if you've got an entrepreneur who's able to make $100,000, $200,000 a year with one of these stores and build it up, and then maybe take on a second store and a third store and a fifth store. And that's when you really start to change things, as far as we're concerned.
So follow-up question on that. Will you put requirements that the entrepreneur has to come from that community? Or could it be that someone who's successful in Hollywood becomes your super franchisee and manage?
Well, it might surprise you. It's almost the opposite. And it's funny. It's like we had to win this huge battle with some of the foundations. And I would say that some of the foundations came from this perspective of, let's make sure it's a person from Compton sort of running the Compton store. And let's keep all these social equity franchise stores in the neighborhoods where they're really needed. And we said, no. These stores are needed everywhere. And we want the Compton, entrepreneur to run the Compton store, but then also to run the store in Silver Lake, you know what I mean? And Studio City and et cetera, because it's not just about access to healthy food. It's about economic empowerment. And by the way, the other thing that may be counterintuitive to that is that doesn't actually mean that the stores in Studio City and Silver Lake make more money. And that's the thing that sort of blows people's minds, is that the stores in South LA and Compton are just profitable, and it just goes to speak to like, there's so little competition and so much demand that it works easy.
Great. Well, thank you so much. I hope everyone enjoyed this session today, had a little bit of gratitude. We got to hear about some great partners at Everytable. Any final thoughts from folks?
I just wanted to say thank you very much for obviously CCI bringing Sam in. Again, I've only been in LA for 4 years, but just hearing about that story, I've been in South LA, and I can totally tell that, it's definitely a huge need. So I just want to say thank you to you, Sam, for your time, and obviously CCI staff for like letting us know what's going on in our community and how obviously we kind of, it's like we both share similar missions, just in different, perspectives or how we approach it. So thank you to you all to, be able to bring this together. So I really appreciate that.
Awesome. Thank you so much.